Hi, everyone. My name is Madeline Mead, and I'm here to share with you some things about patients who are non compliant when it comes to taking medicines that are prescribed for them. Whether we choose to believe it or not, over 30% of all patients in the United States are either refusing to take their medications, or they're not taking it as prescribed, or they stopped taking the meds before the physician tells them to. We have to understand the severity of medication noncompliance and figure out what ways to stop or at least lessen the amount of cases where this happens. At this particular time, studies have shown that 30 to 40% of patients are proven to be noncompliant with their medication regimen. According to Nick Barber, PhD from the University of London School of Pharmacy, he states approximately half of non-adherence was unintentional. He stated, adding that this was frequently caused by patients simply forgetting to take their meds, especially if they were newly prescribed for less than 10 days. Now, Barber also believes that a lack of education about their diagnosed conditions add to non-adherence for patients. In Barber's study, most of the people surveyed believed that they did not have enough information about the new drug that they were taking, and many of them stopped the meds or did not take them as prescribed after 10 days. According to Oyekin et al. In the Permanent Journal, more than 70% of 1,000 people in one survey stated that they would be more apt to comply if they knew more about their illness and how the prescribed medication would help. And this comes from the ncbi.gov website. When looking at case noncompliance, we find that forgetfulness is the cause of 25% of cases. Usually this occurs as patients get older and also include patients with cognitive defects. Another big issue with patient noncompliance has to do with rising drug costs. The cost of medications account for 17% of noncompliance cases. If a patient is not insured or has very little insurance, the cost of certain medicines could be out of reach. The next category of noncompliance is physician-based, including poor communication, patient understanding, and poor doctor-patient relationships. According to the Center for Disease Control and Prevention and the Care Management Society of America, adverse medicine events and challenges with medical noncompliance is the fourth leading cause of death in America. Medication noncompliance can cause health problems to increase, especially if those patients who have more than one condition. By patients not taking needed medications, there is an increase in hospital stays and the length of the stay. This is particularly important for patients taking blood pressure medications and heart medications because of lack of the needed medication may cause anything from a myocardial infarction to a full-blown heart attack and death. Studies have shown, however, that when patients use medications appropriately, there has been a big improvement in the mortality rate, as much as a 40% increase. One of the biggest problems I believe to be present with medication noncompliance in patients is that we as humans often think that we know our bodies better than anyone. So we know what would work and what wouldn't work. And so if we don't think we need the medicine for some reason, then we just don't take it. And a lot of that time we don't discuss that with the physician, so the physician is unaware that we're not taking the medicine. I think that doctors and other healthcare providers really need to emphasize to their patients the importance of taking the medication. They have to be educated They have to educate their patients on what the medicine does and why it will help their condition. Physicians simply cannot be unaware of the patient who is non-compliant, as so many physicians are. Patients who seem to be non-compliant with their medications have to be engaged in dialogue with their medical provider on why they don't think they need the medication. Patients' excuses range from, I just don't think I need such a strong medication. I take herbs that are supposed to help. The medicine makes me feel funny, or I get sick when I take the medicine. All of these excuses have to be discredited by the physician and the patient made aware that these are simply excuses. Some of these may come from fear of what could happen, focusing on the side effects of the drug rather than the fact that it will help them to heal. Patients need to rely on their healthcare providers' expertise and allow them to make these decisions um, based on what they think is best. It's usually apparent that the provider knows the side effects and has determined that the potential for healing outweighs the side effects. Also, when patients stop taking meds because they believe that the meds don't work or that they make them sick, they need to understand that some medicines take time to get fully into the bloodstream so that they can do what they're supposed to do. Unfortunately, some studies reveal that we have patients who stop taking meds before this can occur, that most patients who stop medications do so in the first 10 days. Um, I'd like to just go off script for a moment here and talk about a situation that occurred with me and one of my children. I have three daughters, and they're all adults. The youngest one is 19, and she grew up with chronic migraines. They still occur, but they have gotten less in frequency, and she takes medication as needed. Now, the spring of last year, she came down with a bad sinus infection, and she was prescribed antibiotics and um, medication to drain the sinuses and different things like that. And when I noticed at about day 3, she wasn't getting any better, and so I asked her, was she taking her medications as she was supposed to be? Because this antibiotics didn't seem to be working. Well, she informed me that she was not taking the medicine. And well, I was floored. And I asked her the question of why she wasn't taking her medications. And her response was, well, Mom, I have migraine medicine. And when my head hurts, I just take that and make my room really dark and I lay down like I always do with my migraines. Well, I had to really emphasize and get her to understand that migraines and sinus infection are two different issues. They're two different conditions. So your migraine medicine is not going to help with your sinus infection. Um, you really need to take those antibiotics. And it was just unreal because I had to actually emphasize this every day to her until she had taken all 10 days of the dosage. She started feeling better at about day 3 or 4. Once she started taking them, she started feeling better. She started to excrete the infection, and she was feeling better. So she actually wanted to stop then. So I had to really talk with her and I had to really get her to understand that she needs to take that medicine. We have so many people in this country who have grown up not wanting to take medications. All 3 of my children are that way. None of them want to take medication. They don't want to take pills. They don't want to have to take anything. But when it comes down to your health, and the taking the medication outweighs the reasons not to take the medication, then it's definitely more feasible and more. It's just a better way to go. It's the best way to go because we don't know. We don't know all that that can occur in our bodies if we don't take the medication to help to relieve the symptoms and the condition itself. So my point here today is that medication noncompliance has to stop. We have to get more proactive in getting education to our citizens and letting them understand that you get a healthcare provider who you either have been with for a while or one that you can get with that you think really believe that you can trust, and you go with that. You allow them to use their expertise and to use their guidance in just prescribing you medications for whatever your issue is. We have too many people in this country who are dying because they just refuse to take the medicine. They just didn't think they needed the medicine, and they don't take it. And the biggest part of that for me is that the noncompliance is the physician is unaware of it. The physician does not have any idea, and unless the client is or the patient is tested, there's no way the physician can know other than the fact that the patient is saying, I'm taking the meds, or well, I'm not taking the meds, and here's the reason. That way, the physician can determine that what is needed to discredit these issues that the patient thinks they have. So, in closing, I just want to say that medicine noncompliance in this country is just too high, with 30 to 40% of patients unwilling or unable to get their medicines. It's really a hard thing to swallow. And I hope that this video will help someone out there who has a struggle with medications taking as prescribed, or just feels like they have an issue, some other issue with actually taking medicine for themselves. This is once again Madeline Mead, and I have come with you today to just talk a little bit about medication noncompliance. I hope that this has helped, and I really believe that in the long run, there will be times when people will get better. Thank you, and have a good day.